Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. I'll be discussing the musculoskeletal system. Growth hormone, secreted by the anterior pituitary, and the thyroid hormones, thyroxine, are especially important during infancy and childhood. Deficient or excessive secretion of these results in abnormal development of the skeleton. Testosterone and estrogens influence the physical changes that occur at puberty, the growth spurt, and masculinizing or feminizing changes of specific parts of the skeleton, the pelvis. Calcitonin from the thyroid gland and parathyroid hormone from the parathyroid glands are involved in homeostasis of blood and bone calcium levels required for bone development. Functions of bones. 1. Provide the framework of the body. 2. Bones give attachment to muscles and tendons. 3. They permit movement of the body as a whole and of parts of the body by forming joints that are moved by muscles. 4. Bones form the boundaries of the cranial, thoracic, and pelvic cavities, protecting the organs they contain. Skeleton system. The bones of the skeleton are divided into two groups, the axial skeleton and the appendicular skeleton. 1. Axial skeleton. This part consists of the skull, vertebral column, ribs, and sternum. 2. Appendicular skeleton. The appendicular skeleton consists of the shoulder girdle with the upper limbs and the pelvic girdle with the lower limbs. Axial skeleton. This part consists of the skull, vertebral column, ribs, and sternum. Cranium. The cranium is formed by a number of flat and irregular bones that provide bony protection for the brain. The bones of the cranium are 1. Frontal bone, 2. parietal bones, 2. temporal bones, 1. occipital bone, 1. sphenoid bone, 1. ethmoid bone. Anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Frontal bone. This is the bone of the forehead. It forms part of the orbital cavities, eye sockets, and the prominent ridges above the eyes, the supraorbital margins. Just above the supraorbital margins, within the bone, there are two air-filled cavities or sinuses-lined cavity called frontal sinus, with a ciliated mucous membrane which have openings into the nasal cavity. The coronal suture joins the frontal and parietal bones. Parietal bones. Parietal bones form the sides and roof of the skull. They articulate with each other at the sagittal suture, with the frontal bone at the coronal suture, with the bone at the lambdoidal suture, and with the temporal bones at the squamous sutures. The inner surface is concave and is grooved by the brain and blood vessels. Temporal bones. These bones lie one on each side of the head and form immovable joints with the parietal, occipital, sphenoid, and zygomatic bones. Each temporal bone has several important features. The squamous part is the thin fan-shaped part that articulates with the parietal bone. The zygomatic process articulates with the zygomatic bone to form the zygomatic arch, cheekbone. The mastoid part contains the mastoid process, a thickened region behind the ear. The petrous portion forms part of the base of the skull and contains the organs of hearing, the spiral organ, and balance. The temporal bone articulates with the mandible at the temporomandibular joint, the only movable joint of the skull. Occipital bone. The occipital bone forms the back of the head and part of the base of the skull. It has immovable joints with the parietal, temporal, and sphenoid bones. Its inner surface is deeply concave, and the concavity is occupied by the occipital lobes of the cerebrum and by the cerebellum. The occiput has two articular condyles that form hinge joints with the first bone of the vertebral column, the atlas. Between the condyles, there is the foramen magnum, meaning targe hole, through which the spinal cord passes into the cranial cavity. Sphenoid bone. This bone occupies the middle portion of the base of the skull, and it articulates with the occipital, temporal, parietal, and frontal bones. On the superior surface in the middle of the bone, there is a little saddle-shaped depression, the hypophyseal fossa, in which the pituitary gland rests. The body of the bone contains some fairly large air sinuses lined by ciliated mucous membrane with openings into the nasal cavity. Ethmoid bone. The ethmoid bone occupies the anterior part of the base of the skull and helps to form the orbital cavity, the nasal septum, and the lateral walls of the nasal cavity. It is a very delicate bone containing many air sinuses called ethmoid sinuses, lined with ciliated epithelium and with openings into the nasal cavity. The horizontal flattened part, the cribriform plate, forms the roof of the nasal cavity and has numerous small foramina, through which nerve fibers of the olfactory nerve, sense of smell, pass upwards from the nasal cavity to the brain. There is also a very fine perpendicular plate of bone that forms the upper part of the nasal septum. Face bones. The skeleton of the face is formed by 13 bones in addition to the frontal bone. They are 2 zygomastic or cheekbones, 2 maxilla, originated as 2 nasal bones, 2 lacrimal bones, 1 vomer, 2 palatine bones, 2 inferior conchae, and 1 mandible. Vertebral column. The vertebral column consists of 24 separate movable, 7 cervical, 12 thoracic, and 5 lumbar. Irregular bones, the sacrum, 5 fused bones, and the coccyx, 4 fused bones. Cervical vertebrae. The first 2 cervical vertebrae are atypical. The atlas is the first cervical vertebra, and it consists simply of a ring of bone with 2 short transverse processes. The anterior part of the large vertebral foramen is occupied by the odontoid process of the axis, second cervical vertebra, which is held in position by a transverse ligament. Thus, the odontoid process forms the body of the atlas. The posterior part is the true vertebral foramen and is occupied by the spinal cord. On its superior surface, the bone has 2 articular facets that form joints with the condyles of the occipital bone of the skull. The nodding movement of the head takes place at these joints. The axis body is small and has the upward projecting odontoid process, or dens, that articulates with the first cervical vertebra, the atlas. The movement at this joint is turning the head from side to side. Thoracic vertebrae, 12. The bodies and transverse processes have facets for articulation with the ribs. Lumbar vertebrae, 5. These have no special features. Sacrum. This consists of 5 rudimentary vertebrae fused to form a triangular or wedge-shaped bone with a concave. Anterior surface. The upper part or base articulates with the 5th lumbar vertebra. On each side, it articulates with the ilium to form a sacroiliac joint, and at its inferior tip, it articulates with the coccyx. Coccyx. This consists of the 4 terminal vertebrae fused to form a very small triangular bone, the broad base of which articulates with the tip of the sacrum. Functions of the vertebral column. Collectively, the vertebral foramina form the vertebral canal, which provides a strong bony protection for the delicate spinal cord lying within it. The pedicles of adjacent vertebrae form intervertebral foramina, one on each side, providing access to the spinal cord for spinal nerves, blood vessels, and lymph vessels. The numerous individual bones enable a certain amount of movement. It supports the skull. The intervertebral discs act as shock absorbers, protecting the brain. It forms the axis of the trunk, giving attachment to the ribs, shoulder girdle and upper limbs, and the pelvic girdle and lower limbs. Thoracic cage. The bones of the thorax or thoracic cage are 1 sternum, 12 pairs of ribs, 12 thoracic vertebrae. Sternum or breastbone. This flat bone can be felt just under the skin in the middle of the front of the chest. The manubrium is the uppermost section and articulates with the clavicles at the sternoclavicular joints and with the first 2 pairs of ribs. The body or middle portion gives attachment to the ribs. The xiphoid process is the tip of the bone. It gives attachment to the diaphragm, muscles. Ribs. 12 pairs of ribs form the bony lateral walls of the thoracic cage and articulate posteriorly with the thoracic vertebrae. The first 10 pairs are attached anteriorly to the sternum by costal cartilages, some directly and some indirectly. The last 2 pairs, floating ribs, have no anterior attachment.